Good morning, everyone. Thank you for joining us this morning. I'm Liz Charlotte, Director of Communications at the Mississippi State Department of Health. So as you all know, we reported our first monkeypox case late Monday afternoon. Now, we, like all the other public health departments throughout the country, have been conducting surveillance. That's standard. That's what we do since the first case was confirmed. We've had several suspected cases, but late Monday was our first reported case. I did want to tell you, we just looked at the CDC map and case count. We have 3,591 cases nationally, and that's as of 7/26. And of course, again, Mississippi is included in that. So joining us today is our very own state epidemiologist and genius, Dr. Paul Byers. Are you there, Paul?
Hey, yes, I am.
So talk to us, Dr. Byers, talk to us a little bit about, first, let's start out with what is monkeypox?
Yeah, well, thank you, Liz, and thanks everybody for joining us this morning. Obviously, we're here to talk about something different than COVID, and I know that COVID has taken up a lot of our energies and discussions over the last couple of years, but today we want to talk about monkeypox, and we are reporting out, like Liz said, our first case of monkeypox in the state. It is likely that we will see additional cases of monkeypox identified in the state. Currently, we have not determined that there is any transmission as a result of this case to any other Mississippians. Monkeypox is a viral infection that is transmitted through direct person-to-person contact, either through direct contact with the infectious rash or with scabs or with body fluids, but it can also be transmitted through respiratory secretions through prolonged close contact. That can include things like kissing or cuddling or even sex, but it can also be transmitted through contact with items or materials that have had direct contact or been contaminated by the fluid from those infectious rashes, like things like towels or linens. And so there are multiple ways to get monkeypox. The incubation period is usually 1 to 2 weeks, and once an individual develops symptoms, it usually starts as fever. It can start as flu-like symptoms, muscle aches, but typically will progress to a rash that can look like lots of different things. It can start out as flat, but it can also be blisters, or it can look like pimples, and typically it will be in several parts of the body. It can start on the face, but it can also be in the extremities, on the hands. It can be in the genitals, and for some folks, it can be a very painful rash. And during this time, when a person starts developing symptoms, especially when they have the rash, they can be infectious or contagious to other people that they come in contact with. And the symptoms usually last, can be anywhere from 2 to 4 weeks, but a person is contagious until that rash completely resolves. And when the rash goes away, an individual is no longer considered infectious. The best way to prevent it is to avoid close contact with somebody who may have monkeypox. Avoid close contact with the rash, or don't share linens or towels or cups or utensils of somebody who may have monkeypox. If you think you've been exposed to monkeypox, certainly we want you to reach out to your provider, especially if you develop symptoms. Even if it's symptoms of, like we talked about, that can start out with fever or with flu-like symptoms, go see your provider. If you develop a rash, it's important to isolate and stay away from your family, in your house. Stay away from others in the house. Isolate and see your doctor about getting tested. And so, monkeypox is a public health concern that we all need to be aware of. Anybody can get monkeypox who is directly in contact with it. Regardless of your gender, regardless of your sexual orientation, anybody can get monkeypox who is exposed to it. Now, one of the things that we are working on is vaccination. And y'all know that we've received some vaccine in the state that can be used to help prevent monkeypox for those people who've been exposed to it. But we've received very limited doses. The priority that we want to reserve those doses for is for those individuals that we identify as known or contacts through our public health investigation. So those people that we identify that are contacts to a known monkeypox case, we can provide vaccination, and that can help prevent those individuals from developing infection. We're also looking at expanding the utilization of the monkeypox vaccine to individuals who may have had exposure, or individuals in the last 14 days who may have been in an area where there is known transmission and have had multiple sexual partners. We're working on that, but remember, we have so few doses right now that it's very hard for us to expand our vaccination efforts up beyond trying to make sure that we vaccinate those known contacts. So, you know, we're working with providers. We're doing lots of testing. We're continuing to do surveillance. We're looking for additional cases. And so, you know, we want to make sure that we raise public awareness and make y'all aware of what's going on. And I'm going to throw it back to you, Liz, and we can open it up for questions.
Thank you so much, Dr. Byers. I wanted to also ask you, we want to make sure providers are on the lookout for this as well. Of course, they need to report, but they need to understand that they need to collect their own specimens. We can test them at the public health lab, right?
Yeah, you know, there's lots of options for testing now. Certainly, we have testing available at the public health lab, and we have since the very beginning. And our initial testing has been done at the public health lab. But there are some commercial labs available now that can do the testing. Those include places that doctors normally refer to their labs to commercial labs. And so, you know, what we want is for folks to see their doctor. Their physician can work with us. They can call us. We'll work with their provider on how to collect the test. They can send it to a commercial lab or a reference lab. Certainly, those providers can collect that sample and send it to the public health lab, and we can test it as well. But we do ask providers to reach out to us.
Okay, Dr. Byers, our first question comes from Michael at the AP, and he has said, has the state received a word as to whether or not vaccine supply will increase in the near future?
Yeah, we have. Now, we don't know how much it will increase. Currently, CDC is working on the next phase of vaccine distribution. The vaccine has been distributed primarily. Most of the doses have gone to those areas that have identified most of the cases. And you know, we've got one case in Mississippi so far, and we do expect additional doses, but we really don't know how many we might get.
All right, thank you. Let's see, this is from Kobe at MPB. Are there major differences between the smallpox vaccine and the monkeypox vaccine Dr. Byers discussed a moment ago?
So the vaccine that's available right now, that is the primary vaccine that's going to be used, is Jynneos, and it's a vaccine that is actually directed against both monkeypox and smallpox. And so this is a vaccine that we anticipate is going to help prevent infection from monkeypox when given in a timely manner after direct known exposure.
All right, thank you, Dr. Byers. Let me see here. Let's see, let me scroll up just a little bit here. All right, Courtney Ann Jackson with WLBT. Are you concerned that the general public may not be as concerned about monkeypox, given initial information that gay and bisexual men may have been most at risk of contracting it. What do you want the general public to know? And I think, Dr. Byers, this is important to stress again. Anyone can get it. Right now, we're seeing it in that population, but why don't you let's reemphasize that message. The public should be concerned.
Well, and like I said, anybody who has direct exposure to an individual with monkeypox is at risk for infection, regardless of your gender, regardless of your sexual orientation. Now, because of the fact that this can be transmitted so easily through direct skin-to-skin contact, and certainly in the United States and globally, we have seen many of the cases among men who have sex with men. That doesn't mean that that is the only population that can be at risk for infection. And so it's important for us to understand that anybody can get monkeypox. And so what we want to do is raise awareness about what the exposure may be, how you get it, and what you can do to prevent it, and when you need to go see your doctor.
All right. And let's see. Quentin Jones is asking, how has the COVID pandemic prepared health officials to handle this latest monkeypox outbreak? And is it a concern? Is it a concern having both? Well, here at Quentin in Public Health, we deal with multiple diseases at a time. Doing surveillance and handling these situations is what we do.
Right.
But Dr. Byers, I know your office is incredibly busy right now.
Well, and even it's important to understand that even during the busiest times of COVID, we've still had to investigate other occurrences of reportable and infectious and communicable diseases. We still have to address outbreaks. This is part of the normal operations that we do at the Public Health Department. Certainly, it can get busy at times, but we feel like we have the dedicated and professional staff to continue to address any of the diseases of public health concern that come our way.
Yeah, and I do think, I think even ever since Katrina, everything that we deal with prepares us even more for the next. So we have a pretty well-seasoned team in dealing with
We do, and we continue to build on that team, and certainly, we'll continue to address monkeypox in the same way that we address any potential outbreak or cluster.
Well, I have a question from Mandy with Fox. With school starting in a few weeks, is there a concern for the virus to be spread among children? How does the virus affect children, and are symptoms the same?
Yeah, for children, especially younger children, the infection can be more severe. At this point in time, we're not overly concerned that children are at high risk for this infection, and we're not concerned that we're going to see transmission within school settings.
All right, thank you. Let's see, Mona from the Biloxi Sun. School starts soon. Okay, now this is, what recommendations are you sharing with them? What will you advise parents, and how serious is this when it's contracted by children? I think we've already addressed it. Is there anything you feel needs to be added, Dr. Byers?
No, not at this time.
All right, Kobe's asking, could you
and going back to schools, what I would recommend, and what we recommend for any schools and parents is, number one, if your child is ill with anything, even if it's a rash illness, and certainly children can get viral illnesses that lead to rash, don't send your child to school if your child is ill. Seek care at your provider. Make sure that you have an understanding of what your child has, and that includes things like COVID. Don't send your child to school if they have COVID or flu, and that's the big thing in school settings.
And I think for parents, just let's put in a reminder that they need to get all their back to school vaccines And
Now's the time, yes.
yeah, now is the time, and when the flu vaccine becomes available, do that as well, but definitely keep your children home if they're sick. All right, now Kobe wants you to elaborate on how limited the vaccines are. Are there larger shipments expected in the future?
Yeah, we don't know how large the shipments are going to be. Certainly, CDC anticipates that we will get some additional vaccine as we move through 2022, and anticipates that more doses will be available in 2023 in the earlier part of the year. Right now, we have about 600 doses of vaccine in the state, but it's a 2-dose series. So that's enough vaccine for about 300 people. And again, what we are trying to do is reserve much of that as a priority for those individuals that we identify as direct known contacts to monkeypox, where we can actually intervene and prevent infection in them. We do know that we will get additional doses of vaccine. We don't know the exact timing or how much that will be yet.
And I get this question because of COVID, but the White House is not involved in this as far as it having to be declared a public health emergency in order to get more doses. It's merely a case of manufacturing them.
I think it's a matter of manufacturing and getting the doses. And CDC is working diligently to get those doses out as quickly as they can.
All right, now this is from Courtney Ann again. And she's asking, how does the public protect themselves, particularly if it may not be clear that an individual has monkeypox? For example, people have gotten accustomed to hearing about masking as a defense for COVID. Is there anything people can do, or is it more specific to jobs like housekeeping, etc.? What would put someone at risk? Dr. Byers, is the most transmissible that skin-to-skin contact?
It is, and that's primarily how it's transmitted in this cluster. There is a potential for respiratory transmission, but it requires prolonged close contact with an individual. It's not the kind of contact that we become accustomed to thinking about with COVID, where it takes 15 minutes of exposure to potentially become infected. This is not an infection that is easily transmissible, but it is transmissible primarily through that direct skin-to-skin contact with lesions from monkeypox. And so the best way to prevent it is to not have that direct contact with those lesions.
Thank you. Michael with AP is saying the World Health Organization has declared the monkeypox outbreak a global health emergency. Does this classification change MSDH's strategy for combating the outbreak?
It does not. Our goals are to identify cases, to prevent transmission, to make sure that those cases understand the importance of isolation, to identify the contacts, to provide vaccine to them, to make sure that the public has awareness of what the risks are. And that doesn't change for the Department of Health here regarding the declaration from the World Health Organization. I think it does raise awareness of the public health importance of this disease.
And Quintus is asking, if you think you have been exposed to the disease, what are the necessary steps to take? Should you wear a mask, go to the ER, quarantine? Okay, so I think we've talked about this a little bit, but based on what you've talked about, if you think you've been exposed, shouldn't you isolate and see your provider?
Yeah, if you think you've been exposed, contact your provider. That's the first step. For individuals who are exposed, a person is not infectious unless they develop symptoms. And it's most infectious during the time frame when a person has a rash or has the lesions on them. And so a person who may be in contact but has no symptoms is not contagious, is not infectious to anybody else. And that contagious period really doesn't start until a person has symptoms. They may be contagious if they have fever or muscle aches after exposure. And so what we tell people is if you develop those symptoms after you've been exposed, then it's important to isolate. It's important to see your provider, especially if you develop a rash, then it's important to get testing. And for those people that we identify as direct contacts to a known case, we're going to be monitoring them for the development of symptoms. And we're going to be offering them vaccine to help prevent the development of infections as a result of their exposure.
It would be similar, it's similar to the contact tracing. It's what we do every day in public health.
It is.
To mitigate the spread of disease. Let's see, I have Grayson saying, I joined a couple minutes late. Where in Mississippi is what I think you mean is the exposure. That's not really relevant because it's not like West Nile virus where it's in the environment. So
I think it's important though to share that the individual that we're discussing, this first case, acquired the infection outside of Mississippi.
Exactly. Grayson, do you have any more questions since you joined a little late? I'm just pop them in. Let's see. Okay, that's all she has. So Dr. Byers, I don't see any other questions. Oh, here's one. Courtney Ann, can you say what state they may have traveled to when exposed? I think the individual is out of the country. Is that correct, Dr. Byers?
Well, the individual had traveled, but it was outside of Mississippi, and you know we are starting to see cases all around the state, all around the United States. We're starting to see cases globally.
Yeah. Yeah, because I think there was just a handful of states that did not have any reportable diseases. I think most of them had already reported. Let's see. And then Thomas Howard with the Meridian Star. Can you elaborate on the protections the smallpox vaccine provides against monkeypox? So we talked about this a minute ago.
So yeah, the Jynneos vaccine has got FDA approval for both monkeypox and smallpox. And so this vaccine is effective against monkeypox.
Okay, and let's see, Courtney Ann is asking, you referenced the vaccine being available for known contacts. So unlike the COVID vaccine, there could be protection provided in enough time, even if not taken well in advance of exposure. Is there a timeline? Dr. Byers?
Yeah, no, that's a great question. And so this is a vaccine that is used primarily right now for post-exposure prophylaxis. And what that means is post-exposure prevention of infection. And so you're right. What this vaccine can do is if an individual has contact to monkeypox and they're given that vaccine, especially within the first 4 days after contact, it can prevent the infection. But if it's given within the first couple of weeks after contact, it can reduce potential symptoms that may occur. So you're right, this is a vaccine that we utilize for individuals who've had direct contact so that we can prevent them from developing infection. And by preventing them from developing infection, we can prevent further transmission down the line. And so that's a great question. Now, as we get more doses of this vaccine, certainly the utilization of that vaccine may be expanded. And, you know, I've already mentioned that we're considering some level of expansion for those people who may have been exposed, who think that they may have been exposed. And so we're exploring that now. But again, we have such limited doses at this point that we want to make sure that we reserve a good number of those doses for those individuals that we identify have contact.
Absolutely. And more vaccine will become available, just like in COVID, the same thing.
Yes, it's going to take a while to get it rolling, but we expect it.
Now, I get this question, especially with COVID. How long does monkeypox last on surfaces like doorknobs or gas pumps?
Yeah, you know, there is a potential for transmission associated with exposed materials that have it on them. I don't know the exact time frame for how long it can exist on a towel or on sheets or linens or those types of things, but there is a risk that transmission can occur from that.
Yeah, but I didn't think transmission would occur like on the gas. I understand the linens and the things that, you're using in a household, but could you get transmission with the doorknob or a desk surface or?
Yeah, it's less likely into those circumstances. And again, it would have to be from lesions that are from materials like sheets or a towel that had direct contact with that rash or lesions, not just with your hand.
And would you have to have an abrasion or something, or it's just the contact alone to do it?
It's the contact.
Okay. All right. Now, Grayson's asking, is there any specific age group that is most at risk?
Most of the cases right now have been in young adults, but it's important to understand that the cases that have been identified globally and in the United States have been across the age spectrum, but the vast majority of cases have been in young adults.
Okay, and we have Rayanne. Well, okay, here, I got a little bit out of order there. Okay, let's see, we have a question from JTV. Where can victims, I don't know that, where can victims access the vaccine in the state?
If we identify contacts to monkeypox through our case investigation and contact investigation, we will direct them to where they will get the vaccine, and we will provide that vaccine directly to them. If we get to a point where we are expanding the vaccination beyond those people that we just identify as known contacts, we will be advertising where individuals can access that vaccine.
Absolutely, it'll be just like COVID and everything else. It'll be available on our Mississippi Ready app, on our website, on all of our social media. Rayanne is asking, if someone had a smallpox vaccine as a child, would that protect them from monkeypox?
Potentially, and that's a great question as well. Certainly, the smallpox vaccine that many of us received in childhood can protect and provide some protection against monkeypox. What we don't know is how much protection you may have or how long that protection lasts. And so we think that some people who may have received smallpox vaccine may have some residual protection against monkeypox. We just don't know how much.
Let's hope so, though. I mean, that would cover part of the population.
Just the old folks like me.
I know that's what I was going to say, like you and me. Okay, Mona, and I get this question too. What will be protocol? And we kind of discussed how we would approach this, but what will be the protocol for distributing the vaccine as it becomes available? Those who work with the public, sexually promiscuous, seniors, children. Now, again, we have to remember, Mona, how this is transmitted, the most common ways it's transmitted. And I think Dr. Byers has said first that it would be people that have been directly exposed. And then as more vaccine comes in, those that we know might have risk.
The next piece would be, so right now, the primary focus is post-exposure prophylaxis or post-exposure prevention. And there is an expanded model for post-exposure prevention that includes individuals who may have had multiple sexual partners in the last 14 days and had been in an area where there is local transmission or had potential contacts in the last 14 days with an individual who may have had monkeypox, but wasn't necessarily one of those that was identified directly by the Department of Health. So that would be the next phase. And certainly we'll be working with CDC and determining what would be the next phase after that. But we're not at a point yet where we are vaccinating for pre-exposure. Right now, it's primarily focused on post-exposure. And that's an important clarification I think folks need to understand.
And Dr. Byers, it doesn't look like we have any more questions. The most important point you want to get out today.
Is that we do have a case. It's likely that we will see additional cases in Mississippi. The exposure requires direct person-to-person contact with an individual who has monkeypox. It's most infectious through direct skin-to-skin contact with that rash or those lesions. And so, you know, if you can avoid touching those rash or those lesions, or avoid close contact through respiratory contact and respiratory secretions, that's the best way to prevent it. But just know that it's likely we will identify more cases, and certainly we'll be reporting those out.
All right, well, thank you, Dr. Byers, and thank you to all of you who joined us today. We need your help in getting the word out, so we appreciate you. On behalf of Dr. Byers and the Mississippi State Department of Health, I'm Liz Charlotte, wishing you a great day.
Thanks, y'all. Be good.